Every year, 500,000 women are diagnosed with cervical cancer, and over half of these women will die. Medical Aid Films has produced this film to explain how many of these lives could be saved through screening, early detection, prevention, and treatment. Let's hear from an expert in cervical cancer screening to explain how this works in practice.
It is important to be aware that nearly all cervical cancer is caused by a genital infection with the HPV or human papillomavirus, and this is sexually transmitted. HPV infections can be prevented by giving a course of HPV vaccinations to young girls. Exposure to high-risk HPV can increase with the number of sexual partners a woman may have. So it's important to vaccinate girls before they become sexually active. HPV infections are extremely common in women under the age of 35, but only a small number of women go on to develop abnormal or precancerous changes in the cells of the cervix. These changes can be found through screening. Screening is not a test for cancer. It is a method for detecting precancerous changes in women which, if left untreated, may lead to cancer. In most countries, screening is recommended for women between the ages of 30 and 49. In some countries, such as Uganda, screening starts at the age of 25. The World Health Organization recommends that women are screened once every 5 years, though in some countries they recommend every 3 years. HIV-positive patients should be screened once a year, as HIV women have a higher risk of contracting HPV infection and a higher risk of developing cervical cancer.
Here's our health worker who will describe some different screening tests.
Now we're going to look at the 4 main tests. Visual inspection with acetic acid, VIA, visual inspection with Lugo's iodine test, VILI, Papa-Nicolau PAP test, and the HPV DNA test. Which test you use depends on the equipment you have available in your community. The first 2 tests involve looking at the cervix, so the results are available right away. The last 2 tests require laboratory analysis, so you have to wait for the results. This test is also known as the vinegar test, as normal household vinegar can be used instead of acetic acid. For this test, 5% vinegar or 5% acetic acid solution is applied to the cervix. And after 1 minute, the health worker checks to see if it changes color. When vinegar is applied to abnormal cervical tissue, white spots will appear, so you can make an immediate assessment of a positive or negative result. White spots occur because the precancerous cells have increased protein. Normal cells do not change color, they remain pink. In this test, IDEN is applied to the cervix. If cervical precancerous changes are present, they will appear well-defined, thick and mustard or golden yellow in color, while the normal cells of the cervix stains brown or black. The results from these tests are reported as negative or normal, positive for precancer, or suspicious for cancer. A negative result means the woman has a normal cervix. A positive result means the cervix has precancerous cells which, if not treated early, can develop into cancer. A result reading suspicious for cancer means the woman has changes visible on her cervix that causes you to suspect cancer. She will need to be referred for diagnosis and treatment. The test cannot confirm a cancer diagnosis or the stage of cancer. This has to be done by a colposcopy, biopsy, and examination. If a positive pre-cancer diagnosis is made, then treatment can take place in the same visit as part of the screen and treat approach. This is more convenient for the woman. The visual screening tests are simple, give immediate results, and are easy to perform. This means they can be carried out by nurses or a health worker. These methods are very effective for premenopausal women, but less suitable for postmenopausal women. This is because the transformation zone of these women is often inside the cervical canal and therefore not visible. The transformation zone is part of the cervix where precancerous changes often occur. Due to the occurrence of false positives, some women who test positive do not have the disease. This means that some women will get treated unnecessarily. It may cause them anxiety. However, VIA and VILI produce very few false negatives, so many women will be saved from developing cancer with these relatively simple, safe tests and treatment.
Now it's time to hear about the other two screening methods. First, the Papa Nicolau or Pap test.
The Pap test involves collecting cells of the cervix using a spatula or a brush. These are then smeared onto a glass slide and immediately fixed with a solution to preserve the cells. The sample must be carefully labeled and sent to the laboratory, where it is stained and examined by a trained health worker using a microscope. This determines whether the cells are normal or abnormal and the extent of the abnormality. PAPs have been in use for a long time in some countries. However, they require good laboratory resources and quality controls. They have fewer false positives than the visual tests, but they have more false negatives, which means they are most useful in areas where annual screening is possible. As samples have to be sent to the laboratory, it can be costly and the results are not immediate. The results will come back as negative, positive for high-grade or low-grade lesions, or suspicious for cancer. The Pap test cannot confirm the final diagnosis or the stage of cancer. The fourth screening test is the HPV DNA screening. While all the other tests are detecting precancerous changes in the cervix, this method is used to detect the DNA of high-risk HPV in vaginal or cervical smears. A sample of cells is collected from the cervix or vagina using a swab or a small brush and placed in a container with a preservative solution. The specimen can be collected by the healthcare worker or by the woman herself by inserting a swab deep into the vagina until it meets resistance and then turning it 3 times. The sample is then sent to a laboratory for analysis. Detection of high-risk HPV does not necessarily mean that precancer or cancer is present. It indicates simply that the woman has a HPV infection and that this, if left untreated, can lead to cancer. HPV testing has fewer false positives and false negatives, so the test will tell you more accurately who is at risk. If the results are positive, the woman will still need to undergo one of the other cervical screening tests to establish if the HPV infection has led to the development of cervical precancer or cancer.
So those are the 4 screening tests used to detect abnormalities on the cervix. Now we will hear about what happens next.
All women should receive the results of their test, whether negative or positive. An effective system for follow-up and treatment of women who test positive is an important component for successful cervical cancer prevention. After a positive result, some women may require a colposcopy if there is one available. A colposcopy is the visual examination of the cervix, vagina, and vulva with a special type of microscope which provides illumination and magnification, allowing the cellular pattern to be examined. Application of dilute acetic acid highlights abnormal areas, and a visual analysis of the extent of the precancerous lesions can be carried out. If needed, a biopsy can be performed at the same time. Using a punch biopsy forceps, small pieces of tissue are removed from the abnormal areas of the cervix. The sample is placed in a preservative, labeled, and then sent to the laboratory for analysis. This will confirm whether there is precancer or cancer and the severity and extent, so that appropriate treatment can be given. Colposcopy and biopsies should be performed by properly trained health professionals. Once clearly diagnosed, small precancerous lesions can be treated with cryotherapy as part of the screen and treat approach. Women with larger lesions found with VIA or VILI, or high-grade lesions found with Pap tests or colposcopy should be referred to a gynecologist for procedures requiring more expertise. Before doing the cryotherapy procedure, a VIA or a VILI test will need to be performed in order to identify the abnormal tissue for removal. Sometimes both tests are carried out. Cryotherapy eliminates precancerous areas on the cervix by freezing them. This simple procedure takes about 15 minutes and can be performed without anesthesia by trained professionals who are skilled in pelvic examination and cryotherapy. To perform cryotherapy, a speculum is inserted into the vagina, and abnormal areas of the cervix are identified by applying either acetic acid or iodine. Then a highly cooled metal disc called a cryoprobe is applied to the cervix. This freezes the surface using carbon dioxide or nitrous oxide gas. The cryoprobe is applied to the cervix twice, lasting for 3 minutes each time, with a 5-minute thaw or rest in between. This is called the double freeze technique, or the 3-5-3 freeze formula. Cryotherapy has a success rate of around 90% for the treatment of small lesions. Cryotherapy preserves the uterus and cervix so women can still have children in the future. For big lesions or those thought to be more serious, then a loop electrosurgical excision procedure or LEEP is used. Before any treatment, it is important that the health worker discusses the procedure and the potential side effects with the patient. After treatment, the woman may experience mild pain and cramping and a watery discharge, which should disappear within 2 weeks. The cervix takes a month to heal, and it's important that the woman either abstains from sex or uses a condom during this time. The woman should report to the health facility for investigation and treatment if she experiences fever, severe abdominal pain, foul-smelling discharge, or lower back pain. A follow-up review should take place 4 weeks after the procedure and a further checkup a year later.
Treatment by cryotherapy and LEEP is appropriate for pre-cancerous conditions. If screening suggests there is a suspicion of cervical cancer, then the woman should be referred on for further investigation and treatment. Treatment would depend on the stage of the cancer, the age, and the general health of the woman. Treatment options could include surgery and radiotherapy.
Finally, we hear about how important it is to keep records.
Records should include every woman's clinical record, appointments that have been scheduled, and those that have been kept or missed. This can be a simple paper record or computer-based. With the exception of the Pap tests, there are no permanent samples of the screening test that can be reviewed later. So it's important that all screenings and results are recorded in a logbook. It is also important to make sure that women receive their results, whether they're positive or negative, and that women with positive results are followed up for treatment. Remember, screening alone does not prevent cervical cancer.
This film has introduced you to the principles behind cervical screening tests, treatments, and prevention. In the second film in the series, you will see a step-by-step guide to performing the visual screening tests. And remember, screening alone does not prevent cervical cancer. Follow-up and treatment are key to the prevention of cervical cancer.